Today we will be demonstrating how to use the blood glucose monitoring kit from SpecMedSA. You will need the glucometer, the lancing device, the test strips, and a lancet. These are shown now. If this is the first time using the glucometer, the time and date need to be entered. This needs to be done once and will only take a moment. Begin by turning the glucometer over. Remove the battery cover. Insert the battery and replace the cover. At this point, we turn the glucometer over. The flashing number which appears on the screen indicates the year. For example, if you see the number 12 flashing, this denotes the year 2012. Press the S button until the desired year is reached. Press the M button to proceed. Now select the month by pressing the S button until the current month is reached, and press the M button to proceed. Now select the date by pressing the S button until the current date is reached. Press the M button to proceed. Select the time by pressing the S button until the exact time is reached, and press the M button to continue. The glucometer will read OK and switch off, indicating the setup has been completed correctly. Now the glucometer is programmed and ready for use. Drawing blood is simple and virtually pain-free. Unscrew the front of the lancing device as demonstrated and pull the circular cap off the lancet. Insert the lancet into the lancing device, and when this is done, screw the front component back onto the lancing device. Select a depth which meets your needs. For thicker skin, select levels 4 or 5, but in the case of small hands or thinner skin, select levels 1 or 2. In most cases, rotating the depth gauge to level 3 will suffice. By pulling back the rear end of the lancing device, it is now primed and ready for use. Before the test, the device needs to be coded. This is done easily by using the 4-prong coding cross. The box of strips indicates which code to use. In this case, it will be the numbers 818. At this point, it is also vital to check the expiry date. Find 818 on the coding cross, and with the number facing upward, insert the relevant prong into the side of the glucometer. It is immediately coded. Remove the coding cross. The word OK and the word off will appear. At this point, the device turns off and is ready for use. Remove a test strip from its container and insert it into the glucometer, with the arrow facing upward and pointing into the top of the glucometer. At this point, we take the lancing device. Press the lancing device firmly against any finger and push the blue button. The lancet pricks the finger and a small drop of blood immediately appears. Gently rub from the base of the finger to the lance tip. This will bring more blood to the surface. With the strip inside the glucometer, bring the strip to the drop of blood and allow the drop to make contact with the side of the test strip. Due to the very absorbent nature of the test strip, only a small amount of blood is needed. In just 8 seconds, the result, which is measured in millimoles per litre, will appear. In this case, the result is 4.2 millimoles per litre. Wipe the blood from the finger. After this, eject the used test strip by sliding forwards the eject button on the right side of the glucometer. We remove the used lancet by unscrewing the front component of the lancing device. We take out the lancet, replace the circular cap and discard the lancet. This is how easy it is to use the blood glucose kit from SpecMedSA.